As all of us know, in medical coding, we are having mandatory updates earlier, ICD-10 CM updates as well as CPT updates. So, October 1st, we have learned ICD-10 CM updates related to 2025. So, as all of us know, from January 1st onwards, we need to use CPT updates 2025, which most of the coders eagerly waiting to learn. In today's session, we are going to learn surgery section updates in 2025. If you would like to have other section updates, please mention in the comment section so that I can make one video related to those sections. As most of the coders work with surgery section, I am planning to create initially video related to surgery section, and if you are looking for CPT other section videos, please mention in the comment section. So this video is helpful for the coders who are planning to go for same day surgery interviews, as well as the coders who are planning to write CPC certification exam, and also the coders who are currently working in same day surgery coding, ED coding, denial coding, E&M coding, or any other specialty where this specialty uses CPT codes. So today our topic is 2025 CPT updates surgery section only. So if anyone looking for free AAPC CU webinar links, medical coding jobs in India, USA, UAE, please join in our WhatsApp group. So our WhatsApp group link is included in the description of this video. So in 2025, we are having 270 additions, 38 revisions and 112 deletions. So if you see the table, calendar year 2025 CPT code change by chapter, in integumentary system, we are having 8 additions, 1 deletion. In musculoskeletal system, we are having 1 addition, 2 revisions, 1 deletion. In respiratory system, there are no changes. So in cardiovascular system, we are having 1 revision and 3 deletions. In heme and lymphatic, we are having 4 additions, 0 revisions and 0 deletions. And digestive system, we are having 5 additions, no revisions and 4 deletions. In urinary system, we are having 3 additions and 1 revision and 2 deletions. If you take male genital system, we are having 2 additions, no revisions and 1 deletion. So in female genital system, we are having only 1 revision, 1 deletion. And if you take nervous system, we are having 7 additions, 0 revisions and 0 deletions. If we take endocrine system, we are having 2 additions. Eye and ocular adnexa, we are having 1 addition, and auditory system, there are no changes. So overall, if you go to interview, they may ask you, what are the latest TPT updates and which chapter does not have any changes. So that time you need to tell them. So basically, we don't have any changes in respiratory system and auditory system. So if you observe this table, most of the codes are added in integumentary system, then we are having nervous system, then digestive system. As we have discussed previously, in this session we are going to learn only updates related to surgery section of CPT book. So first we will learn updates related to integumentary system. So before going to learn integumentary system updates, we need to have good understanding of skin anatomy. Why means these codes are based on the skin anatomy. Hence, we need to have good understanding of skin anatomy here. So, skin is having 3 layers. Okay. So, epidermis, dermis and subcutaneous layer. Most of the time in the CPT coding, you will see these words only. Epidermal layer, dermal layer and subcutaneous layer or subcutaneous tissue. So, epidermis is the topmost layer. Dermis is below the epidermis and subcutaneous tissue is below the dermis. So other name for subcutaneous tissue is hypodermis, which is below the dermis. So now we are going to learn new code which is included in the integumentary system for autologous skin cell suspension. So what is this autologous skin cell suspension? In the operative report, you may see it as SCSA also. So skin cell suspension autologous. So what is it basically? So autologous skin cell suspension is a treatment. Okay. So that involves harvesting a small amount of patient skin, digesting it to release epidermal cells, and then spraying the resulting suspension into a wound. So what is the purpose of this autologous skin cell suspension? So most of the time, physician will this technique for treatment of dermal burns, traumatic avulsions, surgical excisions, or for resection of skin cancers. For example, if the patient is having skin cancer, so here physician will remove the skin, correct? So in order to compensate that skin, physician will this procedure of autologous skin cell suspension, where first physician will prepare the cell suspension, then he will use the suspension for treatment of chronic wound, burns, or any other type of skin cancer treatment. So basically separation involves multiple stages. So in the first stage, physician will separate the epidermal cells from the dermis. Okay. So then he will create suspension using the epidermal cell. Then he will spray that suspension onto the wound area or chronic wound area using the spray. So afterwards, so after healing of this spray, so wound heal occurs based on this image. So in order to code this skin cell suspension, we are having three steps. First one is harvesting. So as we have discussed previously, physician will harvest the skin from the patient's own body, usually 1 square centimeter. Then in second step, physician will use proteases to digest the skin, releasing the epidermal cells. As physician here going to use epidermal cells for treatment of dermal burns or any type of excisions or treatment of skin cancers. In third step, physician will spray the suspension onto the wound bed at the ratio of 1:80, meaning 1 square centimeter of biopsy can cover up to 80 square centimeters of damaged area. So here for harvesting, we are having 150,112, 150,112. For preparation, we are having 150,132, 150,114. For application, 150,152, 150,18. So now we will see each and every code separately. Just here you need to remember, we are having three steps in order to code these procedures, where harvesting is one step, preparation of suspension is one step, and spraying of that suspension is third step. So for harvesting, we are having 150,112 and add-on code 150,12. So 150,111 for harvest of skin for skin cell suspension autograft. First 25 square centimeters or less. If you see here, they have clearly mentioned autograft, means physician is going to take or harvest the skin from the patient's own body. Next, this is an add-on code based on the square centimeter physician has removed. So plus 150,12 means this is add-on code. You can't use 150,12 as a standalone code, as it is a add-on code. You need to use this along with 150,11. So this 150,12 is for each additional after 150,11. So each additional 25 square centimeter are part thereof. Okay. Next we are having preparation codes 150,13 and 150,14, which is a add-on code. So first step is harvesting, correct? Then preparation. So in order to prepare the suspension, we need to use 150,13 and 150,14. So if you see the code description of 150,13, it is telling us preparation of skin cell suspension autograft requiring enzymatic processing, manual mechanical disaggregation of skin cells and filtration. So this preparation include all the steps. So 150,13 for first 25 square centimeter and 150,14 is for each additional 25 square centimeters of harvested skin. Next we are having application codes 150,152, 150,18. So application codes, we are having two key terms or keywords in order to code these codes properly. So whenever you want to code application, you need to check the anatomical area as well as the square centimeter physician has used this suspension, and also application of skin cell suspension autograft to wound and donor sites, including application of primary dressing. So if you take 15015 and 15016, you can use these codes for trunk, arms and legs. If you take 150172, 15018, you can use these codes for face, scalp, eyelids, mouth, neck, ears, orbits, genitalia, hands, feet under multiple digits. So here main criteria is if the patient performs application of 480 square centimeter or less, you need to use 15015. Okay. If the patient uses or application of more than 480 square centimeter, you need to use 15015 along with 15016. So these same guidelines will be applicable for 15017 and 15018. Only difference is anatomical location where the application of this suspension will occur. And also one more important thing here you need to remember is these codes are not to be used if non-manually processed. These are for only manual processed suspension. So we'll see now integumentary system deletions. So in integumentary system, they have deleted 15859. So previously we used this code for cervicoplasty. Next we will see musculoskeletal system. First we will see new code in the musculoskeletal system. So which is 25448. Arthroplasty, intercarpal or carpometacarpal joints, suspension including transfer or transplant of tendon with interposition when performed. So basically what is interposition? Placing the tendon in the arthroplasty. So we are having two types of arthroplasty. So suspension arthroplasty as well as interposition arthroplasty. So suspension arthroplasty, otherwise you can call it as suture suspension arthroplasty. You can see it as SSA in the operative report, or CMC arthroplasty with tight ropes is a surgical procedure to treat thumb carpometacarpal joint arthritis. So most of the time patient will perform this procedure for joint arthritis of carpometacarpal joints. Next, what is interposition arthroplasty? So basically it involves surgical dislocation of the ligaments and the joint capsule. So in 2025 January 1st onwards in the operative report, if you see suspension and interposition keywords for carpometacarpal joints or intercarpal joints, we need to use 25448. So in 25448, physician usually uses the tendon as a suspension sling using non-absorbable suture. So this is the anatomy of carpometacarpal joint. If the patient is having any type of arthritic changes in the carpometacarpal joint, patient will perform this procedure of arthroplasty. So in musculoskeletal system, 21632 is deleted, which is radical recession of sternum with mediastinal lymphadenectomy. So in musculoskeletal system, as we have discussed, we are having one revision. In 2024, you will see 21630 as radical resection of sternum semicolon, but in 2025 you can't see any semicolon along with 21630. And we are having one more revision, 25447 arthroplasty interposition intercarpal or carpometacarpal joints in 2024. But in 2025 code description is changed little bit. So arthroplasty, intercarpal or between the carpals or carpometacarpal joints, interposition example tendon. So what is interposition here? In order to perform the arthroplasty, instead of implants, patient will use the tendon. Next we will see cardiovascular system updates. So in cardiovascular system, we are having three deletions, 33471, 33737, 33813. So 471 is for valvotomy, pulmonary valve, closed heart via pulmonary. 33737, atrial septectomy or septostomy, open heart with inflow occlusion. 33813, obliteration of aortopulmonary septal defect without cardiopulmonary bypass. So these three codes are deleted in 2025. So in order to learn cardiovascular system updates, we need to know the few conditions. So here we are having one revision which is for aortopulmonary septal defect. So what is this one? So ASD as an anomaly present from birth. So this which is a congenital defect in which there is abnormal communication between the ascending aorta and pulmonary artery. So this is the ascending aorta and this is the pulmonary artery. So there is a window between ascending aorta as well as the pulmonary artery. So how does the physician perform this repair? So here provider makes an incision to the chest through median sternotomy. Okay, approach and visualizes the aortopulmonary defect. So this one. So in order to reach this area, physician will create incision on the sternum or median sternotomy, and he will reach this defect or aortopulmonary window. After reaching this area, physician uses sutures to attach a patch which may be either pericardial or synthetic material to the defect, which is the usual procedure in order to treat aortopulmonary septal defect. So next we are having the revision here. So in 2024 we are having 33814, obliteration of aortopulmonary septal defect with cardiopulmonary bypass. So what is obliteration? Basically this is correction. So correction of aortopulmonary septal defect with cardiopulmonary bypass. So what is cardiopulmonary bypass? So this is a other name for this cardiopulmonary bypass is heart-lung mission. Okay. So what is the revision here? If you observe this code here, in 2025 code is, number is same, obliteration of aortopulmonary septal defect with cardiopulmonary bypass. Okay. So this semicolon is removed in 2025. Now we will see updates in hemic and lymphatic system. So here also just little bit we need to understand the anatomy related to hem and lymphatic system. So these are the green color ones are lymph nodes, and this is the lymphatic vessel which transport the lymph fluid through the lymph nodes. Most of the time we will use hemic and lymphatic system codes for oncology. So these new codes we will use in from hemic and lymphatic system are for oncology coding or oncology specialty. So what are these? First we will learn here chimeric antigen receptor, otherwise its name is usually we will call it as CAR. So CAR T cell therapy is a way to get immune cells called T cells to fight cancer by changing them into a lab so they can find and destroy cancer cells. So basically using the CAR T cell therapy, physician will create the immune cells called T cells. So these T cells will be used to fight cancer by changing them in the lab. So they can destroy the cancer cells. So in order to fight against the cancer cells, we need immune cells like T cells which are produced in the lab. So these CARs will recognize and binds to specific proteins or antigens on the surface of cancer cells. So the mechanism for action of CAR cells involves the binding of CARs to targeted antigen present on tumor cell surface via SCFU recognition domain, which elicit anti-tumoral effects through the secretion of inflammatory cytokines. So basically here these T cells are having the capability to attack the cancer cells. So if you see this image, first step is remove blood from patient to get T cells. Okay. So next one is make CAR T cells in the lab. So after removing the bed, physician will create the or produce the CAR T cells in the lab. Then what is third step here? Third step is grow millions of CAR T cells. So in lab we will get only few cells, but using this lab we will grow millions of T cells. Okay. Then we will infuse these CAR T cells into the patient. After infusion of these CAR T cells will bind to cancer cells and kill those cancer cells. So the other name for T cells are white blood cells called lymphocytes. They are also called T lymphocytes. So here we are having 4 new codes: chimeric antigen receptor T cell therapy 38225, 38226, 38227, 38228. So 38225 is for harvesting of blood-derived T lymphocytes for development of genetically modified autologous CAR T cells per day. So here we can use 38225 for the collection and handling of the specimen, and may be required only once per day, regardless of the number of collections or quantity of cells collected. So as we have discussed previously, in the preparation stage or harvesting stage, physician remove few T cells and they will grow those T cells in the lab. So next one is 38226, preparation of blood derived T lymphocytes for transportation using the cryopreservation or storage. Next one is 38227, receipt and preparation of CAR T cells for administration. So this is the laboratory procedure where physician will grow CAR T cells for administration to the patient. Next 38228, CAR T cell administration autologous. So which is for injection or infusion into the patient, where you will use 38228. So all these codes will replace category 3 codes, which will be deleted in 2025. So next we will see digestive system updates. So in digestive system, 4 codes are deleted: 47802 YouTube hepatic co-enterostomy, 49203 excision of distraction open intra-abdominal tumors, 49204 and 49205. So these are 5 new CPT codes in the digestive system section, which will describe the excision or destruction of intra-abdominal primary or secondary tumors or cysts via an open approach, including cryoreduction, debulking or any other type of removals. So if you check the code description, 49186, excision or destruction open procedure intra-abdominal. So inside the abdomen, usually peritoneal and mesenteric retroperitoneal, primary or secondary tumors or cyst. Some of the maximum length of tumors or cyst 5 cm or less. So here you need to code based on the diameter of the cyst or tumor. So if it is 5 cm or less, we need to use 49186. If it is 5.1 to 10 cm, we need to use 49187. If it is 10.1 to 20 centimeters, we need to use 49188. If it is 20.1 to 30 centimeters, we need to use 49189. So if it is greater than 30 centimeter, we need to use 49190. So if you see the guidelines here, so basically code selection is based on the sum of the maximum length of the each tumor or cyst excised or destroyed. Only the tumor or cyst is included in the measurement here. So you can't include the margins or surrounding tissue when you are calculating the diameter of the tumor. If a portion of the tumor or cyst is removed, we need to use the dimension or diameter of the tumor or cyst for measurement of coding purpose. Next we will see urinary system guidelines or updates. So in urinary system, one code is deleted, which is, so 2 codes are deleted, 50135 and 51030. And we are having one code revision here in 2024. If you see 51020, cystostomy or cystostomy with fulguration and or insertion of radioactive material. If you see 2025, code description is same, only semicolon is removed from or after cystostomy. So if you see 51020 now, from 2025, cystostomy or cystostomy, first cystotomy or cystostomy with fulguration and or insertion of radioactive material. So this is, so previously cystotomy or cystostomy with semicolon, but whereas in 2025 we don't have any semicolon, we are having only comma after cystostomy or cystostomy. Next we are having one new code in the urinary system, 3 new code for the treatment of BPH related symptoms. So the other name for BPH is benign prostatic hypertrophy. Most of the time in the documentation you will see it as enlarged prostate. So here we are having 3 codes, 51721, 53865, 53866. First we will see 51721. So we will use this code for insertion of transurethral ablation transducer for delivery of thermal ultrasound for prostate tissue ablation, including suprapubic tube placement during the same session and placement of an endorectal cooling device when performed. So here the approach is transurethral, means through the urethra. Physician will insert the transducer, which will be used for ablation of tumor or prostate tissue. These codes also include suprapubic tube placement as well as the endorectal cooling device placement if performed by the physician during the same session. So what are the tips here? This procedure is performed to treat conditions like prostate cancer, and BPH. The procedure involves using thermal ultrasound. Okay, so this is the multi-element transducer. Physician will insert this introducer or transducer through the urethra and he will ablate the prostatic tissue. So this is the heating pattern. If you see, this looks like heat here. So this is thermal damage boundary. So this is the boundary. Until here, physician will perform the thermal damage. Here only the transducer is only placed. And again we are having one new code in urinary system, which is 53865. Cystourethoscopy with insertion of temporary device for ischemic remodeling. So here of bladder neck or prostate. So here your diagnosis will be pressure necrosis. Necrosis means like dead tissue. So what are the tips here? Insertion of device. A temporary device is inserted through the cystoscope and positioned at the bladder neck and prostate. Okay, so physician will use a device and he will insert this device through the cystoscope and placed on bladder neck and prostate. This device applies control pressure to specific areas leading to ischemic remodeling, pressure necrosis of the tissue. This process helps to reduce the size of the prostate and alleviate symptoms caused by benign prostatic hyperplasia. So this procedure is monitored using the cystoscope to ensure the device is correctly placed and functioning as intended. For removal code, we need to use 53866. And as we discussed previously, we are having one more new code here, which is for removal of the temporary device, which we have previously learned as insertion. Next, we will learn updates from male genital system. So 544388 is deleted, which is previously we have used for replantation, penis, complete amputation, including urethral repair. Next, we are having few new codes in male genital system, which are 55881 and 55882. So what is 55881? Ablation of prostate tissue transurethral using thermal ultrasound, including magnetic resonance imaging guidance for and monitoring of tissue ablation. So here also, this is also for prostatic procedure, but imaging guidance difference here. So imaging guidance here is magnetic resonance imaging guidance. So 55882 is for same code 55881 plus with insertion of transurethral ultrasound transducer for delivery of thermal ultrasound, including suprapubic tube placement and placement of endorectal cooling device when performed. So what is ablation here? So ablation is a medical procedure used to remove or destroy abnormal tissue. So ablation of prostate tissue is equal ultrasound plus MRI guidance. So 51721 if only insertion of transfer ablation transducer and the associated equipment. So 51721 is for only for insertion of the transurethral ablation transducer. So next we will see updates from female genital system. So here we are having one code deleted, which is 58957, resection of recurrent ovarian tubal primary peritoneal uterine malignancy. We are having few code revisions here. In 2024, if you take 58958, we are having the resection of recurrent tubal primary peritoneal uterine malignancy with omentectomy performed with pelvic lymphadenectomy and limited para-aortic lymphadenectomy. Okay. So previously we are having semicolon after if performed. Now they have added comma. Means from 2025 January 1st onwards, in the operative report, if you check or if you find pelvic lymphadenectomy, only you can code 58958. Next we will see few updates from endocrine system. So we are having few additions from endocrine system, which are for 60660. Ablation of one or more thyroid nodule, one lobe or the isthmus percutaneous, including imaging guidance, radio frequency. Okay. So and plus 60661, this is an add-on code. So you can use this 60661 if the patient performs ablation of one or more thyroid nodule, one lobes. So basically here we need to code 60660 and 661 based on number of lobes. Okay, not based on thyroid nodule number. So it is based on the number of lobes. If the patient performs ablation of single lobe, we need to use 60660. If the patient performs ablation of one or more thyroid nodules on additional lobe like second lobe, we need to use plus 60661. Next we will see nervous system. So in nervous system we are having one new code 61715, MRI guided high intensity focused ultrasound stereotactic ablation of target intracranial, including stereotactic navigation and frame placement when performed. So basically we will use this procedure for intracranial procedures. Most of the time physician will use this procedure for tremors, rigidity and any type of slowness of movement. Again in nervous system we are having one new code, few new codes for thoracic facial plane block. Thanks for visiting our channel guys. If you like this session, please click on like button too in order to motivate and also provide inspiration to create more videos like this. If anyone looking for same day surgery coding training, please send WhatsApp message to 707-526-3939. If anyone looking for jobs in India, Dubai or USA, please join in our WhatsApp groups. Our WhatsApp group link in the description of this video. And also please like, comment, share, subscribe.